Hello my dear friends, and now welcome back. We are going to continue the discussion of abdomen topic. So we have already discussed about the arterial supply, and in the arterial supply in abdomen there is only one thing, that is abdominal aorta, and we have learned the various branches given by that, ventral branches, dorsal branches and the lateral branches. And now I am going to actually teach you about the venous drainage from the abdomen topic. Now first of all, try to make a concept here guys. In arterial supply we have got only one thing, that is abdominal aorta. But when it comes to venous drainage, there are two systems here. One will be the portal vein and another one is the inferior vena cava. Now, why do we have like two things here? Try to understand it conceptually first of all. Portal vein, it is the one which is going to drain the blood from the gut wall part, that is foregut, midgut and hindgut. From there, the blood will be actually drained by the portal vein. Whereas whatever remaining structures that are left out, like the gonads, the kidney, the suprarenal gland, liver, from all those remaining structures or remaining organs, the blood will be actually drained by inferior vena cava. So that's the concept that you should always have as a medical student in your mind. So one will be the portal vein, another one will be the inferior vena cava. Portal vein draining the blood from the gut, whereas the inferior vena cava from the remaining all the structures. Now that means we have to learn these two topics here. Now after learning these two topics, the next one, at certain important regions, there are anastomosis between these two veins, that is portal vein and the inferior vena cava, and that is referred to as portocaval anastomosis. That is your third topic that we are going to learn in sequence, very conceptually. Okay, so first of all, let's get started with the portal vein. Now I request all of you to please look at this diagram here guys. Whenever you learn about any vein, in the vein you have to always learn about the formation of the vein, how the vein is forming. Now in this diagram, you are able to appreciate here that there will be a splenic vein here, and this splenic vein coming behind the pancreas, and that is the one which is going to join along with the superior mesenteric vein, and this is your superior mesenteric vein over here, and these two will join together to form your portal vein guys, hardly a matter of like 8 centimeters long. So portal vein, and that portal vein will go into the liver and dividing into that right and the left branches over there. So basically, how is the portal vein formed? The portal vein is formed by the splenic vein and the superior mesenteric vein together. So those two will combine together to form your portal vein. And observe very carefully where exactly that is formed guys. Relation is important here. The portal vein is actually formed behind the neck. This part of the pancreas will be a small neck here guys. So I hope you all have learned about the pancreas, the different structures of that, the head, neck, body and tail. So this is the neck of the pancreas, and portal vein is formed behind the neck of the pancreas here. So best way, let us draw our diagram here and make the things more simpler. So the first topic to learn here, portal vein. So let us draw our diagram here for the portal vein here. Now this one here will be the uncinate process, the head, neck, body and tail of the pancreas. And just behind the pancreas, you will be able to see there is a vein which is going to come all the way from the spleen here. That is your splenic vein. And this splenic vein is going to join along with the superior mesenteric vein coming from here. And these two will join together to actually form your portal vein guys. So splenic vein and the superior mesenteric vein together, they are actually going to combine and form your portal vein. So let us write down the name here. That is your splenic vein. And this combines along with the superior mesenteric vein. And these two will combine together to form the portal vein here. Now, my dear doctors, like 2 points you have to remember here, or you can write it somewhere else, that portal vein will be actually formed like behind the neck of the pancreas. That is one important thing. And even this superior mesenteric vein you can observe here, that is also passing behind the neck of the pancreas over here. And then one more important thing, where at which level is this portal vein forming here? Remember, the portal vein is forming at the level of L2 here. So the portal vein is forming at the level of L2, one important thing, and remember it is forming behind the neck of the pancreas. And then this portal vein will actually go and drain the blood into the liver. So inside the liver, what is going to happen? It is going to divide into those right and the left branch. So imagine this one to be the right and left branch of the portal vein. Fine. So that is crystal clear about the formation of portal vein. I repeat all these 4 points for the last and final time guys. Formation. The portal vein is formed by the splenic vein and superior mesenteric vein. And these two are going to combine behind the neck of the pancreas at the level of L2. and hardly, yes, the portal vein is like 8 centimeters long. It will go inside the liver, dividing into right and left branches. Now, what is the next thing that we need to learn here? Whenever you learn about any vein, you got to learn about the tributaries of that. So let us see what are the tributaries of the portal vein. First of all, it is going to receive like two veins which are going to drain the blood from the stomach. So in this diagram, I'm not drawing the stomach and everything. It becomes like more complicated. So try to just understand there will be a right and then there will be a left gastric vein. This will be the left gastric vein here, and then there will be a right gastric vein. So those two are the one which are going to drain the blood from the stomach directly into the portal vein. Then the next one here will be, there is a vein around that umbilicus swella part, and that will be actually known as what, guys? The para-umbilical vein. So even the para-umbilical vein is the one which is going to drain the blood into the portal vein directly. Para-umbilical vein. And then after this, one more important vein which is going to drain the blood directly into the portal vein will be the cystic vein. Cystic vein will also drain the blood into the portal vein. Obviously, cystic, the name itself is indicating it is from the gallbladder. So cystic vein will be draining the blood into the portal vein and even the para-umbilical vein. And the last and final one which is left out here, let me just draw it here, guys. One more vein, that is superior pancreatico-duodenal vein. That is superior pancreatico-duodenal vein. So these are all the veins which are direct tributaries of the portal vein, guys. So I think it is very clear in the diagram here. Let me just repeat again. Right and left gastric vein, and then the superior pancreatico-duodenal vein, then the para-umbilical vein, as well as the cystic vein. All these veins are the one which are tributaries of the portal vein, draining the blood into the portal vein, guys. Perfect. Now, once you are comfortable with this topic, as I told you in the very beginning of this one, the planning here, after completing the portal vein and all the tributaries of that, the next thing that we have to learn is inferior vena cava. And then we'll see the anastomosis between these two, that is portocaval anastomosis. So let us go towards the next topic, that is inferior vena cava, guys. Now, if you compare from the abdominal aorta, we studied that abdominal aorta will descend down from T12 all the way up to the level of L4, and at the level of L4 it is dividing into common iliac arteries. And exactly corresponding to that one, there will be common iliac veins, and both the common iliac veins will combine together to form inferior vena cava. But one thing that you have to be like literally careful here, abdominal aorta is ending at the level of L4, dividing. But whereas inferior vena cava is beginning at the level of L5, one level below at the level of L5. So it is not at the same level. So common iliac veins will combine together to form inferior vena cava at the level of L5. And you know very well it will be ascending up, ascending up, ascending up. And then inferior vena cava crosses through the vena cava opening in the diaphragm and drains the blood into the right atrium of the heart. Fine. So better we'll do one thing. We'll actually draw the diagram and try to understand the formation as well as the tributaries of inferior vena cava. And there is a beautiful concept here. I'll let you know what is the important point to remember. Now imagine this thing to be your diaphragm here. Just a schematic diagram here, guys. Now if this is your diaphragm here, imagine this one here to be your inferior vena cava. And inferior vena cava is the one which is formed by the two common iliac veins. So let us just write down here, these are the two common iliac veins. But one thing to be more careful about is, remember it is formed at the level of L5, not at the level of L4. At the level of L4, abdominal aorta will divide into common iliac arteries, but inferior vena cava will be forming at the level of L5. Now, after learning the formation of this inferior vena cava, now what is the next thing to learn? Obviously, we need to learn about the tributaries. Now, tributaries here, let's start one by one in this diagram here, guys. First of all, you'll be actually having the right gonadal vein. And be very careful here. It's only the right gonadal vein draining the blood into the inferior vena cava, not the left one. I'll tell you where will the left gonadal vein drain the blood. Right gonadal vein. Then after that, try to understand or remember here in the lumbar region, you'll be actually having lumbar veins. I hope you remember from the arterial system that we have discussed. They were actually 4 pairs of lumbar arteries which are originating from the dorsal aspect of abdominal aorta. So corresponding to those lumbar arteries will be actually having lumbar veins. So lumbar veins draining the blood into inferior vena cava. Then imagine here this one to be your right kidney, and then there will be a left kidney here, and from both the kidneys the blood will be draining into inferior vena cava, and without any doubt the name of these veins will be renal veins. Both the renal veins are draining into inferior vena cava. Now if you have your kidneys over here, above the kidney you'll be actually having suprarenal gland, and only the right suprarenal vein will drain the blood into inferior vena cava, not the left one. I'll tell you where the left suprarenal vein will drain the blood. Then after this, you just imagine your liver, and from the liver, hepatic veins are the one which are draining the blood into the inferior vena cava. Just to recall you again here, don't try to measure my diagram over here, guys. It is just a schematic diagram. That is not the relation of liver and inferior vena cava. Inferior vena cava is just behind the liver. We have already discussed in the topic of liver. So it is not the exact or anatomical diagram that I am drawing here, just for the sake of remembering. Instead of writing all these tributaries in the form of point wise and just remembering with the help of a mnemonic or something like that, I'm just trying to make you draw a schematic diagram so that you remember more better. Now the last and final thing, from the diaphragm there will be a vein which is going to drain the blood. Anything related to diaphragm will be phrenic, and this vein will be inferior phrenic vein. This is inferior phrenic vein from either side draining the blood into inferior vena cava. So in this manner, very easily you will be able to remember all the tributaries of inferior vena cava. Let's have a revision here. From the diaphragm, number 1, inferior phrenic vein, and from the liver, hepatic veins, and then only the right suprarenal vein, and then of course both the renal veins, and then lumbar, and then only right gonadal vein, and lastly even the common iliac veins. Common iliac veins are the formative veins. They are also draining the blood into inferior vena cava only. That's a simple diagram to remember all the tributaries. Now we are again stuck at the same point here. So if only the right suprarenal vein and only if the right gonadal vein will drain the blood into inferior vena cava, then what about the left one? So let me just take another color here. The left suprarenal vein will drain the blood into left renal vein. Left suprarenal vein will drain the blood into left renal vein, not into inferior vena cava. And similarly, the left gonadal vein, even the left gonadal vein also will drain the blood into left renal vein. Left gonadal vein will also drain the blood into the left renal vein. That's a very important point that you have to remember here. So the left suprarenal vein and the left gonadal vein, both of them will drain the blood into left renal vein, not into the inferior vena cava. That's an important point to remember there, guys. Now that's all. That completes everything regarding the inferior vena cava also. Now once you complete the topic of portal vein and the inferior vena cava, let us see what is this portocaval anastomosis that we have been confused a lot from our first year MBBS days, and what is the clinical application of that. That's really important. Okay, so better first of all let me show you in the atlas diagram there, and then afterwards we'll actually make the notes for this. Now please observe this diagram very carefully on the screen there. You are able to appreciate both the portal vein as well as inferior vena cava in the same diagram. So in this diagram here, you are able to appreciate the inferior vena cava as well as the portal vein. Now portocaval anastomosis, there are many sites of that one where the anastomosis will be formed. But out of all of them, I want you all to remember 3 important regions, the 3 important sites of portocaval anastomosis. Number 1, this anastomosis will be formed at the lower end of the esophagus, lower 1/3 of the esophagus. Number 2, this anastomosis will be formed at the rectum. And number 3, the portocaval anastomosis will be formed at the anterior abdominal wall, around the umbilicus, of course. Okay, so near the umbilicus. So there are 3 important sites that you have to at least remember for your exams. You don't have to worry about all the portocaval anastomosis sites. At least these 3 sites you have to remember: esophagus, the rectum, and the umbilicus. Now out of these 3, let me just teach you about the rectum wala part over here. So let me just teach you one anastomosis there, and then other ones automatically you'll be able to understand. Now from the rectum, you are able to appreciate that this is the vein which is going to drain the blood from here. And this vein which is going to drain the blood from here will be the superior rectal vein. Superior rectal vein is the one which is going to drain the blood from the rectum here. Now let us try to trace this and find out whether the superior rectal vein belongs to the portal system or the caval system. Is it going and draining in portal vein or is it going and draining in the inferior vena cava? Let us try to trace that and find out. Now this superior rectal vein will further drain the blood into inferior mesenteric vein. That is inferior mesenteric vein. I hope you are able to recall here. When we studied about the arterial system, try to recall that in your mind. That will help you a lot in learning this. Don't try to just simply mug up. When we studied about the arterial system, inferior mesenteric vein is the one supplying to hindgut. And in the hindgut, it is supplying to the descending colon, sigmoid colon, and the rectum. And to the rectum, there was finally superior rectal artery. In fact, superior rectal artery is actually the continuation of inferior mesenteric artery only. So corresponding to that artery, we are actually having the vein there. There it is superior rectal artery and here it is superior rectal vein. And there the artery is a branch of or it is a continuation of inferior mesenteric artery. And here it is going and draining into inferior mesenteric vein. It makes sense here. So superior rectal vein will be actually draining into the inferior mesenteric vein. And we can clearly see in our diagram here, the inferior mesenteric vein will go and drain the blood into this splenic vein here, guys. And just few minutes back, I taught you the splenic vein is actually the one which is forming your portal vein. Oh, that means, it means what? It means that the superior rectal vein will be actually the vein of your portal system. It is the one which is going to drain the blood into the portal vein belonging to portal system. Now let us try to find out the anastomosis of this one. Now on the other side, you will be able to appreciate the middle and the inferior rectal vein here. This will be the middle and inferior rectal vein. So from the rectum, you'll be actually having like three sets of veins: superior rectal, middle rectal, and inferior rectal. So middle and inferior rectal vein, you can clearly see they are going to drain the blood into this internal iliac vein. Internal iliac vein. And this internal iliac vein is going to combine with the external, and together they are going to form the common iliac vein. This one here. This will be the common iliac vein. And we have just now learned the common iliac veins on both the sides, on either sides, will combine together to form your inferior vena cava. So it means what? It means that the inferior and the middle rectal veins, inferior and the middle rectal vein, these two veins are finally going and draining the blood into inferior vena cava. That means they belongs to the caval system. And from this now I can tell very confidently, yes, right at the rectum. Rectum is one of the site for portocaval anastomosis. Portocaval anastomosis. That makes the concept like crystal clear. So basically what you have to remember for your exams here, portocaval anastomosis, the site is rectum, but there at the rectum, which vein belongs to the portal system and which vein belongs to the caval system. So the vein which will belong to the portal system will be superior rectal vein, and the vein which is belonging to the caval system will be the middle and inferior rectal vein. I hope it is crystal clear. And similarly at the other side also, like at the lower end of the esophagus, you need to learn about the veins which are going to drain the blood into portal and caval. Similarly, near the anterior abdominal wall around the umbilicus, you got to learn about the veins which are going to drain the blood into portal and caval system, guys. Hope you're understanding this one here. So let us first of all try to make a list of all that, and then later on what we'll do, I'll tell you about the clinical correlation of this one here. So let us see like the different sides of portocaval anastomosis. So as I told you, there are like so many sides of portocaval anastomosis. Out of that, I want my students to remember three sides. Number one, rectum. Number two, esophagus. And number three, remember about the umbilicus. Umbilicus, there are three sides of portocaval anastomosis, importantly, that you have to remember: rectum, esophagus, and umbilicus. Now, at these three sides, you have to find out what is the vein that will be belonging to the portal system. In another one, we have to learn about the vein which is belonging to the caval system. I mean to say, which will drain into the inferior vena cava. Now, near the rectum, just now we have seen the vein which is going to belonging to the portal system will be superior rectal vein, and the veins which are going into the systemic circulation, that is into cable, will be the middle and inferior rectal vein. Middle and inferior rectal vein, guys. Perfect. Similarly, near the esophagus, you will be actually having the esophageal branches of left gastric vein. Left gastric vein, which will be going and draining into the portal vein. And that is what we have discussed just now. You can clearly observe here, this is the left gastric vein. And left gastric vein is one of the direct tributaries of portal vein only. So that is belonging to portal system. Now it is going to form the anastomosis with what? Which belongs to your cable system. So it is going to form again the anastomosis with esophageal branches of hemiazygous vein. Hemiazygous vein. In fact, it will be accessory hemiazygous vein. Esophageal branches of accessory hemiazygous vein, and we know that will be actually going in draining into this systemic circulation. And around the umbilicus, you will be actually having paraumbilical vein, which will be draining the blood into portal vein. Paraumbilical vein. And the veins which will be belonging to systemic circulation will be the superficial veins of anterior abdominal wall. Superficial veins of anterior abdominal wall. Perfect. So that is what you got to remember at all these three locations, but don't try to mug up this table directly, guys. Yes, try to understand first of all with the help of this beautiful diagram here. Then the remaining things will become damn easier for you. Now, once you have understood the normal thing here, let us see the clinical application, the abnormality. What is going to happen? I think you people have learned in the pathology, whenever there will be like a liver pathology, most of the time you will see the etiology as alcoholism. So alcoholism will finally affecting your liver, and there will be some sort of liver pathology. I'm not going into that depth right now. And the complication of that will be actually portal hypertension. For example, cirrhosis of liver and all, it will lead to portal hypertension. From the name itself, you can understand that, so there is like increased pressure in the portal vein, portal hypertension. Now guys, it is a general rule in physiology that blood flow will be always from the higher pressure towards the lower pressure. But here what is happening here is the pressure is increasing in the portal vein itself, that is portal hypertension. So when the pressure is more over there, will the blood be draining back into the portal vein? No. So blood pressure is more higher in portal vein itself, portal hypertension. That's the reason why the blood will not be draining back. Instead of that, the blood will be actually retained back or pushed back into the veins around the rectum there. And over a period of time, what will happen? Those veins in the rectum will be dilated permanently. And that is nothing but the hemorrhoids. So you can see the consequences starting from the alcoholism, then the liver pathologies, leading to portal hypertension, and then finally leading to, dilatation of the veins permanently in the rectum. That condition is known as, hemorrhoids. Internal hemorrhoids will occur. Similarly, what will happen near the esophagus? There also the same thing. Same explanation again. There also the veins will be dilated, and that is known as the esophageal varices. And then around the umbilicus also the veins will be dilated. That condition is actually referred to as, that is caput medusae, guys. So all the three locations, let us see what is the clinical correlation. What will be the applied aspect here? So almost everywhere it is the same thing only. It is like dilatation of veins only, but different names are given at different locations. So near the rectum, what is going to happen, sir? It will lead to hemorrhoids. And then near the esophagus, it will actually lead to esophageal varices. And then near the umbilicus or around the umbilicus, that condition is referred to as caput medusae. So I hope you are understanding the importance of this portocaval anastomosis and what is the clinical correlation about that. And I request all of you to learn in the same manner. Don't try to learn randomly portal vein somewhere, inferior vena cava somewhere. Let us finish this topic by the same thing from where we started actually. Whenever you learn about the venous drainage from the abdomen, divide them into two systems. One is portal, another one is the cable. Portal vein mainly draining the blood from the gut, whereas inferior vena cava will be draining the blood from the remaining structures. and together they are going to form anastomosis. Various sites are there, but importantly you have to remember three sites: the rectum, esophagus, and the umbilicus. Why? Because it is clinically more important there, and you have to always remember which vein belongs to the caval system and which belongs to the portal system there, guys. I hope it is crystal clear concept. That's all done.